close.
Yeah, this time next week will be it, right? Tuesday.
Yeah.
Okay. Get some food ready. Get a kitchen together.
I'll be glad to take that.
Oh.
Thank you.
Tuesday is kind of a good day for Christmas because most people get Monday off, and you get too, so it's kind of, you can get everything in. You have to do like multiple families.
It was not.
We're all synced up as far as soon as you're working.
We are.
It's off by 3 seconds.
Oh, okay.
We'll have a talk about that.
Well, we'll let the record reflect that. But.
There was a glitch between 5 minutes and 4 minutes. It took me 3 seconds to pick up on it.
Good evening. I'd like to call this Tuesday, December 18th, 2018 meeting of the Middletown City Council to order. Please stand and join me in a moment of meditation and the pledge of allegiance to the flag. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Ms. Gank, would you call the roll, please?
Ms. Vittori. Mr. Bohannon.
Here.
Mr. Moon.
Here.
Mr. Mulligan.
Here.
Mayor Mulligan.
Here. I'll entertain a motion to excuse Ms. Vittori and I should have previous engagement.
So moved. Second.
Would you call the roll, please, Ms. Gank?
Mr. Bohannon.
Yes.
Mr. Moon.
Yes.
Mr. Mulligan.
Yes.
Mayor Mulligan.
Yes. All right, our first order of business this evening is a public hearing for a map amendment case 8-18, a map amendment request by the applicant, David Montgomery, on behalf of Kettering Medical Center for the zone change of two properties located at 6147 West State Route 122, Middletown, Ohio, 45005, parcel ID 0703427021, approximately 13.677 acres, and the property located at the 3400 block of Union Road South of State Route 122, Middletown, Ohio, 45005, parcel ID 0703427015, approximately 2.452 acres, per the Warren County Auditor, from the current BCH, Business Center Hub, zoning district to BCO, Business Center Office, zoning district. If approved, the applicant is proposing medical office and hospital uses. Ms. Combs?
Good evening.
Good evening.
Okay, as Mayor Mulligan introduced, this is for two properties to be rezoned from BCO, Business Center Office. BCH, Business Center Hub, to BCO, Business Center Office. What you see here is the zoning map. The two parcels, the larger is 13.77 acres, as previously mentioned, and the smaller is 2.452 acres. The surrounding zoning is BCI to the north, the BP gas station, BCH Business Center Hub to the east, the CVS and vacant land, BCH Business Center Hub to the west, which is I-75, and BCR Business Center Residential, which is residential, and a church to the south. This here is the aerial map that you're looking at. It's zoomed in just a little bit more. As you can see, that purple indicates the now Kettering Health Network facility. Some surrounding pictures of the site. Picture number 1 is the Kettering Health facility from the BP gas station. Number 2 is the Kettering Health facility looking from CBS and Union Road. Number 3 is the 34 Union Road block. It's east of the current facility now, which would be behind it. Project background. Previously, the property located at 6147 West State Route 122 was the former site of the Rayton Inn Hotel that closed in 2014 and was demolished in 2016. In May 2017, Kettering Health Network facility received preliminary and final development plan approval. The Kettering Health Network started construction of the facility in summer 2017 and finally had its grand opening in August 2018. Staff analysis, the current use is emergency medical clinic. It is principally permitted use in the BCH zoning district. The applicant is requesting a zone change to have the ability to offer overnight stays at the facility, which would categorize the facility as a hospital. Per the Middletown Development Code, facilities that allow for 24-hour care are only permitted in the BCO Business Center Office Zoning District. Per the applicant, they are requesting the rezone of the subject properties from BCH to BCO because the current facility attracts a variety of patients with a multitude of different medical needs. Emergency services result in the need for patient transfers since the current facility can only care for patients up to 23 hours. The zone change will give the ability for the facility to effectively adapt to the needs of the community and expectations to deliver medical service for the which is vital for the health, safety, and welfare of the community. Staff analysis. Per the Middletown Development Code, hospitals are defined as an institution providing health services primary for human inpatient medical surgical care for the sick or injured, including related facilities such as laboratories. The use may also include outpatient departments, training facilities, central service facilities, and staff offices that are an integral part of the facility that go beyond general care typically administered within a doctor's office. Per the principally permitted uses table of the Middletown Development Code, the only difference between the allowed uses in a BCH versus BCO are the requested BCO office center sub-district allows for skilled nursing or personal care facilities, veterinarian offices or animal grooming, and hospitals where the BCH business center sub-district does not. Staff believes that the requested zone changes are necessary and would not create spot zoning due to the surrounding East End properties being zoned as sub-districts of the overall BC Business Center zoning district. If approved, the zone changes will be beneficial to the facility and will allow for Kettering Health Medical to provide improved care for the Middletown community. Through attracting developments such as Kettering Health Medical Center, the city will achieve its goal of recruiting upper-scale developments and diverse offerings. City Middletown Master Plan 2005. Nearly 15 years have passed since the City of Middletown adopted its last master plan. The city achieved many of the objectives and strategies described in that plan, but it's become severely out of date in regard to future development needs of the East End. The 2005 master plan identifies both the subject properties are located in the Renaissance Development Opportunity Area. This opportunity area was planned to be developed and landscaped, master planned business park with amenities such as common open space, trails, restaurants, business support retail, a hotel, and conference center. The growth to occur in the Renaissance area was to fulfill the master plan goal of diversifying the local economy and creating 3,000 new economy jobs. The city is in the process of updating the master plan. Just as identified in the 2000 master plan, the updated plan identifies the East End as a special interest area for future development. The East End will continue to serve as an important role in recruiting upper-scale uses to the main gateway of the city. The proposed Business Center Office Center zoning district will complement the current businesses in the area and will play an important role of the growing Middletown's economic base. The updated master plan is to be adopted sometime in mid-2019. East End Master Plan 2007 and Warren County Gateway Plan West 2030 Plan, which was adopted in 2015. The properties are a part of Middletown's East End. Per the Gateway Plan West 2030 Plan, the East End is envisioned to be a regional job creation node with a planned use mix, including office uses. Most of the recent development in this area has been in the healthcare field, anchored by Atrium Medical Center, Dayton Children's Medical Center, and Greentree Health Science Academy, among others. The East End area aims to attract growing demand for new office, commercial space, and housing for the growing community that is beginning to connect Dayton and Cincinnati. The interchange at I-75 is Middletown's front door. The East End Renaissance area is the stage for developing upper-scale business and living environments. The East End plan describes the goal of the East End area to be a regional business and living center that is economically and environmentally sustainable mixed-use balance of office, medical center, service and general retail, residences, and hospitality. The plan is designed to optimize land through quality development at optimum densities to create and retain jobs and diversify the community tax base over the next 15 to 25 years. Going back to the staff analysis. Per the Middletown Development Code requirement for legal notice for map amendments, meeting notice letters were sent to all property owners within 200 feet of the properties regarding the zone change request, and those comments were provided to council for review as a part of their staff packet. Other city department comments, economic development. The Economic Development Department is supportive of the Kettering Health Network map amendments as requested. The newly constructed facility, which opened in August, represents a $30+ million investment in the East End and the addition of 110 new jobs to the community. Allowing Kettering to expand service offerings based on the needs of the community is a natural outgrowth of the plan to serve the community. This request is also consistent with the cluster approach of medical developments on the East End, including Atrium Medical Center, Dayton Children's, and Green Tree Health Sciences, as well as the Cincinnati Eye Institute. As the city looks to add residential capacity, it is important to provide residents with a choice in health care. One only needs to look along the I-75 and I-71 corridor to witness the changing landscape of the healthcare delivery. We would expect other complementary medical uses to find benefit in locating in or near our existing cluster of medical offerings in the East End. Review criteria. This is the review criteria that Planning Commission used to make their decision, and per the Middletown Development Code, recommendations on decisions on map amendment requests should be based on the consideration of the following criteria. 1, the proposed amendment is consistent with the master plan, other adopted city plans, and stated purposes of the Development Code. 2, the proposed amendment is necessary or desirable because of changing conditions, new planning concepts, or other social or economic conditions. 3, the proposed amendment will promote the public health, safety, and general welfare. 4, the proposed amendment, if amending the zoning map, is consistent with the stated purpose of the proposed zoning district. 5, the proposed amendment is not likely to result in the significant adverse impacts upon the natural environment, including air, water, noise, stormwater management, wildlife, vegetation, or other impacts that will need to be substantially mitigated. Or 6, the proposed amendment is not likely to result in significant adverse impacts on the other properties located within the vicinity of the subject property. Planning Commission recommendation. Map amendment case 8-18 for the zone change of the two properties were recommended by Planning Commission as approval on November 14th to City Council. The Commission agreed that with staff's recommendation that the proposed zone changes would not be spot zoning and meet the review criteria for a map amendment per the Middletown Development Code. That concludes my staff report.
Okay, thank you. Any questions from council for Ms. Combs? All right.
Thank you.
Thank you. With that, we'll open the public hearing. I'll ask if anyone is here to speak in favor of the proposed map amendment. Good evening. If we get your name and address for the record, please.
Daniel Tryon, 6147 West State Route 122, Middletown, Ohio. Well, good evening, Mr. Mayor, Mr. Vice Mayor, and City Council. Thank you for your time this evening. I have the pleasure to serve as the administrator of Kettering Health Network Middletown. And while many of you may be familiar with our organization and the work that we're doing here in Middletown, I'll spend just a few minutes to share kind of some of the context of our request tonight. I want to start off with saying a big thank you. We're very grateful for the opportunity to work with city staff over the course of the last year. Their support and guidance and partnership has been incredibly important to us and has made Middletown a very attractive place for us to grow. So a huge thank you for that. Joining this evening are two people that will speak with me on behalf of Kettering Health Network. The first is Terry Burns, President of Kettering Medical Center System and Executive Vice President of Kettering Health Network. And we also have Dave Montgomery from Pickerel, Schaefer, and Ebling. As the staff report described, we're before you this evening to request a zoning map amendment for our two properties located at 6147 West State Route 122 and the adjacent property on Union Road. We're requesting that amendment from a BCH to a BCO zoning district. We are very grateful for the support of city staff, and after the analysis and discussion with a planning commission, I'm grateful for their support as well. We believe that this, if approved, will be something that will have a very positive impact on our community. As we get started tonight, I'd like to respectfully request that at the end of the public comment section, we be granted just a few moments to respond to any questions that may come up during that time. Would that be okay?
Sure, I think we could probably allow for that.
Okay, thank you. At the Planning Commission, I'm going to hand out a quick document here.
Thank you.
At the Planning Commission meeting, we handed out a document, and what you're seeing here is an updated version of that document. You may have seen it before. This is the data that is the foundation of our request. You will hear me speak to several of these numbers over the next couple of minutes. And this is a foundation for us choosing to serve our patients here in Middletown, as well as a foundation for our rezoning request. And while we do talk in terms of data, we also see these as people. Each number on this piece of paper is a patient that we're trying to care for in the best way that we can. For me personally, and for Kettering Health Network as a whole, we've been blown away and just so grateful for how embracing and inviting the Middletown community has been. We had more than 3,000 people attend our opening celebration, residents and visitors, and just really appreciated them coming out to celebrate with us. We've just really been humbled by the warm welcome. Our facility has not only created more than 100 new jobs, but so far has taken care of more than 8,000 patients and their families. Number of patients has grown faster than we initially projected, and the feedback that we hear from our patients says that they greatly value this addition and this option for choice here in Middletown. Kettering Health Network's faith-based mission is to improve the quality of life in the communities that we serve. One way that we do that is through providing compassionate health care to patients. We're also proud to serve Middletown by providing preventative, upstream-focused health screenings and education to try and prevent patients from ending up in the hospital in the first place. We're very proud to open up our community room to the public, and we're proud to support local events, local churches, and local organizations as a part of the great work that they're doing here in Middletown. It was listening to our patients that brought us to this point and brings us here this evening for this request. In the year prior to opening our Middletown facility, 13,078 Middletown residents chose Kettering Health Network for care. We compare that to the population of about 50,000. That's 26% of our Middletown community that selected Kettering Health Network as their care team. And as an organization, when Kettering Health Network is in a position where we need to expand to create capacity for the patients that choose our care, we have the option of either expanding one of our existing facilities to make them larger, or looking at where our patients are coming from and building a facility closer to our patients and growing to meet those patients' needs. And that's what our patients request from us and what we want to provide. Our leadership team at Kettering Health Network is committed to providing high-quality care, cost-efficient care locally in a local setting. We're committed to investing in the city of Middletown. We believe that local care is the absolute best model. The healthcare industry is changing at a very rapid pace. We're seeing our healthcare insurance providers and patients becoming much more savvy consumers. They're wanting a choice, they're wanting access closer to home, and we're trying to provide that for them. We believe that for us, some of these smaller, more focused facilities that are able to be right-sized and nimble allow us to meet that need for our patient. The region insurance companies tell us that they see us as the best value for their patients and a strategic partner. We played a lead role in implementing a number of prevention-focused partnerships with these payers that are value-based agreements, where our goal is to make sure that we're focused on prevention, focused on keeping patients out of the hospital, and when they are there, focusing on giving them the best experience possible and being efficient with the resources that we have. We participate with all 5 of the Medicaid payers in this region and the majority of the ACA providers as well. Our faith-based mission at Kettering calls for us to support all patients regardless of their socioeconomic status. We're blessed to share in 2017, our organization provided more than $175 million worth of unpaid care across our service area. And in this year, 2018, that number will be even higher once the year closes out. For Middletown specifically, we want to take care of the patients that have most need. Since we've opened our Middletown Emergency Department, 58% of the patients that we have seen have been either uninsured or underinsured via Medicaid. So there are a portion of our patients that are insured commercially or with Medicare, but 58% have been either uninsured or underinsured since we've opened our doors. And our care for those patients doesn't just end with them coming and leaving our emergency department. We're also proud to support local critical healthcare assets that help to have a prevention focus and provide care for that population. Organizations like federally qualified health centers, our hospitals in our system have a 14-plus year history of partnering with an organization like Primary Health Solutions, who has an incredibly innovative approach here in the Middletown community. We're grateful to have the opportunity to support them. They just recently opened a school-based clinic on the campus of our high school here in Middletown, and just a really innovative approach to healthcare that we believe is great for our community. We believe that our development has helped to aesthetically improve the first impression that potential visitors will have as they drive by and hopefully take our Middletown exit. We're grateful to have the opportunity to serve as additional ambassadors to try to foster growth around our site specifically and across the Middletown community. For us, it's very important to see the Middletown community succeed, and we do whatever we can within our power to play a role in supporting that. Since we opened in August, we've continued to listen to our patients. The incredible response our Middletown campus has made it clear to us that there was a need here, and we're excited that the community is embracing the potential for choice. Across Ohio and really across the country, health systems like Kettering Health Network are looking for the most cost-efficient way to take care of patients. Health systems like Kettering are building small facilities that include an emergency department, maybe a small number of beds, and an array of outpatient services to meet their patients' needs locally. And for today, we're asking for the zoning change based on a very thorough analysis of our patients' needs. We are currently serving patients who are forced to travel, forced to leave Middletown to seek the care team of their choice. And just as an example, over the past 4 months, more than 450 patients have asked for us to transfer them out of Middletown to one of our other Kettering Health Network facilities. And on any given day, for just Middletown residents, we generally have about 13 Middletown residents that are in an inpatient stay in one of our Kettering hospitals. The vast majority of these patients would have been in a position to complete their course of care if our facility was zoned differently. And so that is why we're here this evening. We're seeking this change not just to meet current needs, but also anticipated needs for our patients. We are constantly listening. We are here in Middletown because Middletown residents have chosen us for their care. And we want a chance to provide the best care we possibly can for them. We want to give our physicians, our clinical team, a comprehensive array of resources to provide that care. And this request allows us to do that. With this, we believe the real winners will be the community of Middletown and the surrounding communities that will have the opportunity to make a thoughtful decision for their care. We want to offer for those who want it, in some cases, based on insurance or other things, those that need it, we want to offer a choice and access to our care. And so we want to play a role in helping Middletown grow and to grow with Middletown as much as we can. So with that, I would like to bring up Terry Burns to share a few words as part of the executive team for Kettering Health Network.
Good evening. If we get your name and address for the record, please.
I'm Terry Burns. I live at 1458 Champions Way in Xenia, Ohio. Thank you.
Good evening.
Thank you for the privilege of being here, Mr. Mayor and Council. I'm going to echo some of what has just been stated and just share that we were invited to bring the Kettering logo, bring Kettering to Middletown by people who live within this community, who routinely sought and seek care within the Kettering brand. We didn't come here by accident. We started researching. We identified a key location. We collaborated, of course, with the Planning Commission and with the Planning Department to construct a facility that we think portrays the community in a great light and is a gateway location. Our goal is to provide high quality care with choice, access to our unique facility, and we're honored to serve and look forward to enhancing our capability with this proposal. We appreciate your consideration of it. Thank you.
Thank you.
Last, we'll bring up Dave Montgomery from Pickrell, Schaefer, and Ebling.
Good evening. If we get your name and address for the record, please.
Yes, David Montgomery, 2700 Kettering Tower, Dayton, Ohio, 45423.
Good evening.
Good evening. Thank you, Mr. Mayor, Mr. Vice Mayor, and members of council. Daniel and Terry have given a pretty thorough presentation, so I'm going to try to keep my portion of this relatively short. What I did want to do is I wanted to take a few seconds and simply focus upon the criteria that staff had mentioned during their presentation and obviously, as you are well aware, is contained within your zoning code to which the application is supposed to be measured. Excuse me, I've been recovering from a cold for the past week or two. So if you'll indulge me for just a second, I don't want to be overly redundant with what has previously been said, but I do just want to highlight a couple points. So the first criteria that you have, again, under Section 1226.03E of the city's development code, indicates that the proposed amendment is consistent with the master plan and other adopted city plans and the purpose of this code. Ashley had spent a fair amount of time talking about this. This was discussed also during the Planning Commission meeting. I know you guys have a transcript of that. That was a pretty extensive hearing. So I don't want to spend too much time on this, but the plans that the city has adopted and upon which the city relies do speak to this area for medical use. They do talk about new economy jobs, and they do talk about creating economic engines and catalysts for future development along the Renaissance and the Gateway areas. So the decision for this property to be utilized for medical use has already been made. A little bit different than some of the other conversations and presentations that I know you are presented with. This is an instance where we're taking an existing facility which has already been utilized for medical use, and we're asking for a slight change within the BC zoning classification. That's a much more subtle change than what's typically being asked when you go from, for example, agricultural zoning to a business or residential type use. In this instance, we're talking about just simply shifting from a BCH to a BCO classification. And as Daniel and staff have indicated to you, the primary purpose behind that is to allow for patients to have greater than 23-hour stays. So with the idea and the concept that medical use is already existing on the property, and as staff has indicated, we do feel that the request before you this evening is consistent with your with your adopted plans. The second criteria is the proposed amendment is necessary or desirable because of the changing conditions, new planning concepts, or other social and economic conditions. Much of what you heard this evening does talk about bringing patient choice to the citizens of your community. As Daniel and Terry had both indicated, there is a very fast-paced change, I guess, within the medical fields. That relates to not only the delivery of medicine, but again, from patients being more of consumers. So patient choice is a critical piece of that puzzle, and the care for patient choice is also a critical piece of that puzzle. One of the limiting factors, as we've known, and really, again, is the crux of the application, indicates that once we hit 23 hours and 59 minutes, we're required to make alternative plans for those patients who are with the hospital or in the emergency department. And a lot of this, again, relates to then having to transition those same patients who wish to stay with Kettering Health Network to other facilities located outside of your city. So this change is a direct reaction to the feedback, as Daniel talked about. It's an outgrowth of the existing medical needs and the existing medical needs of your community, and again, the delivery of those services within the existing facility. The third criteria is the proposed amendment will promote the public health, safety, and welfare of your community. And here again, we're talking about a hospital use. That hospital use is the definition within your zoning code that we're dealing with. But at the end of the day, a hospital is probably one of the most public health, safety, and welfare uses that I can think of when it comes to property, perhaps outside of a fire station or other EMS type of facility. But again, it all relates to medical use. It all relates to the caring of the citizens of your community and within the region as a whole. This, again, is a direct reaction to the outgrowth and the desire of the citizens of your community to have choice and to have medical needs, and, again, the delivery of those services. The fourth criteria, again, talks about the proposed amendment is consistent with the stated purpose of the proposed zoning district. And simply to touch upon how your development code defines the BCO sub-district, again, what the primary purposes are to encourage the development comprised primarily of office and medical use. Additionally, it's to create a more open campus-like environment with greater automobile convenience than the BCH subdistrict. To some degree, this is a bit of a moot point in the sense that we're already dealing with an existing medical facility, But I would point out the fact that this property is located along the 122 corridor, State Route 122 corridor, in addition to being adjacent to I-75, pedestrian access and pedestrian use to this site is somewhat unrealistic. So with that, the site's been designed for the automobile component of that, and obviously, as we've talked about, medical use is the exact use that we're talking about, which again is one of the primary purposes of the BCO district. The fifth criteria relates to the proposed amendment is not likely to result in significant adverse impact upon the natural environment, including air, water, noise, stormwater management, wildlife, and vegetation, or such impacts that will be substantially mitigated. Again, we're talking about an existing facility. This zoning change isn't bringing about different components to the property. This is working within the existing facility. Because we are dealing with a development site and because there's no future development at the moment attached with this application, again, I'm not exactly sure as to the applicability of this condition, but to the extent that it does apply, any impact would easily be mitigated. EMS is already operating at the facility because of the emergency department component, automobile, patient care, all that stuff. That's already comprehensively being addressed with the existing facility. Item 6 is the proposed amendment is not likely to result in significant adverse impact upon the other properties within the vicinity of the subject lot. So in this regard, certainly within, as you saw upon the zoning map, which staff presented earlier, the use of this property for medical use has already been determined. It's an operating facility, and we are dealing with a zoning change that, again, allows for inpatient stay. The impact, if you will, again, EMS, fire, safety, that has all been determined at the time of development and at the time of development plan approval. Traffic, again, we're talking about a facility that's located along the I-75 and State Route 122 corridors. Those are more than certainly able to absorb any impact that this zoning change would bring about to the roadway systems. Infrastructure, sewer, water, again, none of that is impacted by this zoning change and the uses that would be accompanied with it. We're dealing with an existing facility, and again, all of those determinations have already been made. So with that, I'd like to certainly open the door to any questions that you have. Daniel, I believe you had a concluding remark or two. But we do thank you for your time this evening, and we appreciate your attention to the request before you.
Thank you.
Thank you. I just wanted to pause briefly. If you have any questions, I'm happy to answer them now. If not, I'm happy to come back at the end and answer anything then.
Any questions for the folks from Kettering?
I had 2 items. I'll just ask them both at once, and you can address them however you like. Both in the near term, and you talked about growing long term. Do we have any idea how many beds we're talking about? And then the follow-up is, it seems like a lot of networks are expanding with the satellite offices and the ER and the inpatient, whereas you guys are requesting to do the opposite. I'm guessing, why is it different here than it is throughout the region where we're seeing something a little bit different?
The answer to the first question, we are currently building a facility up in Troy. That facility is a facility we consider to be a full-service hospital. It gives us the opportunity to build anything that we would need to in that community. In that situation, we chose about 20 to 30 beds. For us, if the zoning request is approved for Middletown specifically, we would go through a planning process, talking to our patients, trying to right size. Somewhere between 4 and 6 patients every day are currently leaving Middletown and going to one of our other facilities. And so we would start with trying to figure out what space would make sense to take care of those patients and go from there. But for us, right now, our definition of a full service hospital in today's industry really is in that 20 to 30 kind of bed range. And I apologize, if you don't mind on the second question, just one more time.
Sure, it just seems very common that we see more of the satellite campus with the outpatient and the ER, and not necessarily building a full-service hospital. I'm wondering what makes it unique here that you want to expand to do the full service as opposed to kind of stay how things are.
Yeah, sure. So for us, I think it really comes down to a patient choice and capacity. So across our system, depending on the time of year, sometimes some of our larger facilities do come into some capacity issues. And for us, as we seek to grow and create capacity to make sure that every patient has the best experience possible, we then have the option to decide where to grow. And that's where our default preference would be to grow as close to the patient home as possible if there is a care setting that allows us with technology and with a great care team to provide excellent care. And so as close to home as possible. I think today's technology does allow us to have some of these smaller bed facilities that can provide really exceptional care for patients. And so that's really why we need to grow somewhere, and our preference would be that growth happening here in Middletown.
Thank you.
Anything else for Mr. Tryon or the folks from Kettering? Okay. Thank you.
Thank you very much. Appreciate it.
All right, is there anyone else to speak in favor of the proposed map amendment? Good evening. If we get your name and address for the record, please.
Matt Kiefaber, 6612 Cedar Crest Trail, Dayton, Ohio.
Good evening.
Good evening. So yeah, I'm Dr. Kiefaber. I'm the medical director for the Kettering Health Network Middletown ED. I've been a practicing emergency medicine physician within Kettering Health Network for 13 years now. Tonight I would just like to share some of my observations, experiences that I have had in regards to caring for those from the Middletown area. So when I first began my career, it was common for our patients to have to drive surprising distances to come see us. But a lot has changed since then. A lot now has really been driven by our patients who now have greater access to information and want more choice and convenience in obtaining their health care. This has resulted in a big push to bring health care out to these communities, allowing them to receive the full spectrum of health care from primary care services, ED services, hospital stays, continuity of care with specialists, and even kind of rehab care as needed. Bottom line is that these patients want to stay close to home. Historically, we have taken care of a large number of patients from Middletown, as you have heard, who were traveling to our other hospitals for their care. I would often see patients from Middletown at Kettering, Sycamore EDs, and they would tell me that they would go nowhere else other than Kettering Health Network, because that's where they trusted their care with. When Kettering Health Network first announced that they would be building an ED here in Middletown, I repeatedly heard from these patients how excited they were that we were bringing our services here. I also had met and talked with local EMS and the surrounding EMS here prior to our opening, and they also told us how excited they were that we were going to be here. They also told us from day one to expect to be very busy, as they would tell us that they already had numerous patients that they were transporting, say, is Kettering Middletown open yet? Because that's where they were asking to be brought to. And then, as you heard at our open house, we had an amazing turnout, and then we saw firsthand how excited the community was that we were here. I would also say that we've also developed a very close relationship with the Middletown Police. Actually, our very first patient was brought in by the police. It was actually brought in 1 hour prior to our officially opening time. It was a patient requiring care after fleeing from a canine. But we now have multiple patients brought in by the police every day, ranging from requiring medical clearance to needing mental health evaluation. As you heard, we opened our doors on August 8th, and as anticipated, we have been very busy since day one and have already surpassed our daily volume predictions for year end. We have continued to see and hear from both the community and EMS how excited they are that we are here. I am also informed by many of our patients that we are really their only option in the area for care in regards to their medical insurance. The one thing, though, that we hear over and over again from our patients once they enter our doors is how impressed they are with us and that they want to continue their ongoing care within the Kettering Health Network. Currently, when one of my patients needs hospitalization, they most often are asking me to transfer them to one of our other hospital sites. By having inpatient beds here, this would allow us to continue our goal of providing our patients with the best possible care close to home and close to their family. Being able to keep our patients close to home is not only convenient, but even more importantly, improves responses to treatments and promotes recovery for the patients we serve. I would also add that as a nonprofit faith-based health system, Kettering Health Network and the Middletown facility is held to the same high standards as every other health system when it comes to care and seeing all patients, especially the underserved in our communities. We see and care for everyone that comes through our doors. We offer top-of-the-line services and do that because of our community and patient-focused mission, and we do all this regardless of their ability to pay. In closing, I'd like to say that I'm honored to be part of the Kettering Health Network team. and I'm exceptionally proud of the care we have brought and are providing here in Middletown. I am excited to not only see the services we offer expand, but also the growth in our involvement in the community here. Thank you.
Thank you. All right, is there anyone else to speak in favor of the proposed map amendment? Anyone else to speak in favor of the proposed map amendment? All right, hearing none, I'll ask if there's anyone to speak in opposition to the proposed map amendment. Is there anyone to speak in opposition to? Good evening. If we get your name and address for the record, please.
Mike Ewell, 1 Medical Center Drive, Middletown, Ohio.
Good evening.
Good evening, and thank you for giving us a few minutes. First, let me start off by saying that we fully respect the difficult position that the City Council and the city is in to make a decision that will significantly impact its second largest employer. We know we've been through a lot of conversations around that, but our position remains firm that this will have significant impacts on us as well as the city in long term. We stand very firm that again, we heard a lot about the criteria tonight. We stand firm in our belief that the current proposal does not meet the criteria, and a lot of it goes back to the first bullet point, which is the master plan. We've heard that we have a dated master plan. I've been involved and a participant in the current revisions of the master plan, and our position has always been, even through the last years, let's get the master plan done so we understand what we're dealing with in the Renaissance District before we go forward. As we heard Ms. Combs say, that master plan will not be done until 2019. We're also concerned about the master plan and what it may mean for the Renaissance District because of our campus size, our acreage, and the aligning properties that we currently own. We also feel, and I appreciate Mr. Moon asking some specific questions, because our other stance has been that we need to make sure that you, as council making this decision, feel fully informed. I appreciate you asking some direct questions tonight. A few clarifications where Mr. Tryon did say that it's 20 to 30 beds in Troy. I would be remiss if I didn't share with you, they have gone on record 6 days ago in the Dayton Business Journal that their Troy facility is going to be 40 beds. They talk about 13,000 patients. We're not clear if those are Middletown, or I'm assuming some of them are coming from zip code 45044, which we know runs the gamut down into Monroe and Liberty Township. So our ask would be that you continue to ask very specific questions as to what the long-term plan is. I can tell you, for being in healthcare for such a long time, you don't make a request like this and you don't do capital budget planning without having some degree of bed size or total bed volume in mind. So, and again, I want to remind City Council that we didn't initially oppose Kettering being here in Middletown. We only opposed the inpatient beds because we stand behind the fact that it will have significant impacts on the community. It will, in fact, raise the cost of health care for the local community as well, and it's an unnecessary duplication of healthcare resources. Mr. Tryon is right. Our industry is changing. It's becoming more consolidated. It's moving to an outpatient model, which begs the question of why, once again, we need to add more inpatient beds and duplicative services. I appreciate the difficult decision that you're making as we move forward. In closing, that I would ask the support of City Council on behalf of Premier Health and Atrium Medical Center to stand behind us as well in our future business decisions that we have to make, that will be so we maintain our financial and future viability, and also give us pause to any of the property or parcels that we own until we have a period of time to thoroughly and adequately evaluate any long-term impacts that this decision may have. Thank you.
Thank you. All right, is there anyone else speaking in opposition to the proposed map amendment? Anyone to speak in opposition to? Anyone to speak in opposition to? Okay, hearing none, we'll close the public hearing, and we'll move on with the rest of our meeting. Mr. Atkins, our city manager reports.
Your Honor, I have no city manager reports tonight. I wasn't sure how long this was going to go on, and so I didn't want to take much of your time this close to Christmas.
Very good. Well, thank you. Anything for Mr. Atkins? All right, I've got a number of citizen comment cards this evening. I'd like to invite Miss Rita Mayfield down to the podium. Did I get that right? Good evening. If we get your name and address for the record, please.
Yes, it's Ruth Mayfield.
Oh, Ruth, sorry about that. Okay.
Okay. I live at 15 Hinkle Road, Middletown, Ohio.
Good evening.
Good evening. I just wanted to address the cat situation. My home burnt down 4 years ago, and we bought our home over on Creekview and Hinkle Road. There was some people that lived down the street from us that hoarded cats, and they rent, so they turned them all loose. So all of a sudden, we had like 55 cats in the neighborhood. I have a cleaning business. I work full-time. I have my mother that's 92 years old, and I have a son that is bipolar. But somewhere in my day schedule, I find time to feed these cats at 9 o'clock in the morning, and I take the food back before it gets dark out, for I don't feed possums or raccoons. I have trapped 35 cats, got them fixed, and they are spayed and neutered. They do come and eat, and then they kind of wander off. I don't think anything in the United States of America should have to be starved to get rid of. It has been somewhat of a burden. I spend a ton of money on them. I have found home those 40 cats, but it's down to about 20 cats now, and they do come and eat and go. Some of them are friendly, some aren't. I just think that you guys need to take an overall look at it. There are good people, and there's many people in here right now that I know that try to help the situation. Has put a damper on my marriage a little bit. My husband's not a big cat lover, but I just think you need to take an overall look at it instead of just saying, you know, starve them or find somebody, because it's mainly irresponsible owners who have got the cats and then don't want them, and so they turn them loose. There should be a law against that. And I guess that's all I want to say, and thank you for your time.
Thank you. Appreciate you coming down this evening. All right, next I have a card from Miss Judy Smith. Miss Smith?
Good evening. And
Good evening.
thank you for recognizing the problem that we're having.
Sure. Can we get your name and address for the record, please?
My name is Judy Smith.
Okay.
I live at 415 Glen Lane, Middletown, Ohio.
Thank you.
Thank you. I belonged to Angel Animal Rescue for many, many years, and we have helped a lot of people that don't want their cats anymore because either they're not puppies now or they're not kittens. And people call and say they're going to harm them if we don't take them right away. We have placed so many animals, and we don't ask anybody for any money. We do it on our own because we feel like there is a need to help them. Asking a neighbor if a stray cat can walk through their yard is ridiculous. It's like saying, can my little child walk through your yard? Because these cats and dogs, they go from one house to another, just like kids. So please consider what you're doing before you do it, because starving them is not the answer. We get them fixed. Again, we don't ask anyone for any money. The shelter is very helpful with helping us place animals and getting them fixed. If someone wants to get their animal fixed, they can go to the animal shelter and they help them. And they try to find homes for all these furry children. So thank you for your time. I know each of you might have had a pet sometime in your life, and I know you've got children, and children run free, so why do these cats have to? It's ridiculous to have to ask someone if my cat can walk through their yard.
Thanks for coming down this evening. The next card I have this evening is from Miss Missy White. Miss White. Good evening. If we get your name and address for the record, please.
It's Missy White, and it's 2807 Mormon Place in Middletown.
Good evening.
Good evening. I was concerned about the part on here on the neighborhood site that we all get on is about not letting your cat go outside if they have to keep it to stay in the yard, or you have to get permission from your neighbors that can go in their yard, all that stuff. It kind of upset me because we have a lot of cats. We have multi-cats, but we're responsible. We get them fixed, take them to the vet, all that. But we have 2 outside ones. One's feral, one's not. They keep the rodent population down. We got trees and stuff out back, so we don't have to worry about that. Well, the thing that's bothering me about this letting the cat thing out in the yard, okay, I've got proof right here. They've done studies with cats with GPS where they go in a 24-hour period. This is the least amount for the one study they did. Roaming for 2.7 acres is this one right here. They kind of go all over the place. Well, I've got all these that go from 2.7 acres. I got one with 3 acres on it where it goes with the map. 7 acres and 8. Here's the 8 acres. One night, 24 hours. 24 hours. That's where cats go. 8 acres is a long way. And that's just one night. So to tether a cat in a yard is impossible, and it's dangerous because they'll hurt themselves. They're a danger to themselves, tying them up. Dogs too. Any animal you put in the yard unattended with a rope, it's gonna hang itself pretty much. So what I was wondering about was the fact that a lot of cities in the U.S. right now and years back have passed ordinances that pertain to restraining pets. I'm nervous. Sorry about this. I was a little nervous. I got to make sure I remember all this stuff. Okay, well, they have passed all these ordinances in the cities that have to do with restraining pets. And it's cats, dogs, and other animals tethered to a stationary object. It's considered cruelty to animals. And a few of them, Norfolk, Virginia in 2015. We've got Frankfort, Kentucky in 2010. And we've got Denham Springs, Louisiana in 2009. And a lot of these that are talking about the tethering, they're pretty much, they've put in the ordinance to have the police, the cable and the police systems for the dogs so they don't get wrapped up around their ropes. But as far as the other animals, they shouldn't be tethered, or it's just a death sentence. I mean, to watch your animal hang themselves outside because you had to go to the store for 10 minutes is not right. So I would ask you if you consider to follow lead with these other cities in the U.S. that already have passed this law and that will be passing it soon, and the ones that have passed it have not changed it since then, that against the animals being tethered. It's really cruel. So, yeah,
all right.
So that's it.
Thank you for coming down this evening. All right, next card I have is from Miss Catherine Hartung. Good evening. We'll get your name and address for the record, please.
Catherine Hartung, address 914 Connor Drive, Hamilton, Ohio.
Good evening.
Good evening. So I am a dog foster for Joseph's Legacy, and I had the opportunity to look over the ordinances. Unfortunately, much of what I saw, some of it I don't think you guys could actually do. Some of it is a right to privacy issue. You're talking about private property. There's aspects where I know you guys mimic the ORC, which is fine. But there's one point I wanted to definitely bring out, and I just wanted to explain a part about where you're talking about ear tipping. I would challenge everybody to pull out their phone and look up ear tipping. It does not anywhere state that the animal is microchipped. Ear tipping is for when they are fixed. So I think you're going to create a lot of confusion among the animal community with that one, and I would highly suggest removing that one. The other part too, as we go through, 618, you have including all dogs and cats and other companion animals. Companion animals in of itself already includes dogs and cats. So it's almost redundant to repeat that in any part of your ordinances as you go through. And then, let's see. The other part that kind of concerns me is in 618.03, you have, this section does not apply to a licensed veterinarian or public official in their respective acting in an official capacity. That kind of concerns me because that has to do with killing or injuring animals. And in reality, most of our ORCs only permit a veterinarian or someone who's licensed or certified to be able to euthanize an animal. So that particular section needs to be removed. And actually, if you want to cite to anything as far as euthanizing an animal, I would highly suggest going to 4741, which basically covers veterinarians, anybody who's certified, that kind of thing. Let's see. Also, too, where you list in 618.05, cruelty to animals, cruelty to companion animals, on A2, you change the verbiage, which most of this, like I said, it kind of mirrors the ORC, but on that particular one, you change the verbiage to shelter from man-made, man-made artificial enclosure. I don't know what the purpose of that would be, but when you go to altering the ORC, sometimes you take away from it, and that, by law, you can't do that. You have to either enhance it or improve on it or add to it. You can't remove parts from an ORC in order to make an ordinance.
Ms. Hartung, in the interest of time, I'd maybe suggest that if you summarize these details and send us in an email, possibly.
I absolutely will.
That'd be helpful, because I've got a number of cards to address this evening, and
okay, let me
ask you to maybe summarize.
A couple more points, and I'll forward this to you. Another one that concerns me is the part where you say no owner shall maintain upon their premises a number of household pets, dogs, cats, other animals to create a nuisance to be contrary to an appropriate health or sanitary conditions. I think you need to be clear on how many animals that will entail. I know there's a lot of fosters who live in Middletown itself, and you know, some of us can get up to 5, 6, 7 dogs, quite a few cats, you know what I mean? So maybe add a provision, I don't know, something to kind of, a little bit of a reprieve for those who are trying to do well by the animals, you know what I mean? And one last thing. And I think this is important to the residents of Middletown, and in this section, hang on. I'm trying to find it. There is a part where you're talking about that private property in any pen, lot, yard, or enclosure situated within 300 feet of an inhabited dwelling place other than the dwelling place of that person raising, keeping, maintaining, or harboring of such animals. That, like I said, I think is going to be an overstep for Middletown. That's actually covered in Ohio Constitution, where you are able to have your inalienable rights. All men are by nature free and independent and have certain inalienable rights, among which are those of enjoying and defending life, liberty, and acquiring and possessing and protecting property and seeking and obtaining happiness and safety. And I think, you know, animals we know are considered property, and your house is your private property, and I think you have every right to do. You know, if you don't want to have your cat or dog microchipped on your private property, I think that is your own right. You know, I think it's an overstep. Now, in public, that's different, but private, not so much. But I will forward this.
Thank you.
Thank you for your time.
Appreciate you coming down this evening. All right. And I apologize, but I realize in my haste to move to the public comments, Mr. Trine, you asked for some follow-up, and I failed to call you up for the public hearing. Did you have anything you wanted to follow up on? I apologize. Burns is going to do it. So we'll reopen the public hearing, and Mr. Burns, thank you.
Just for the record, at Troy, we're building a 20-bed inpatient facility and an emergency room. The 20-bed inpatient facility will be 16 what we call med-surg beds and a 4-bed intensive care unit.
Okay.
It's 20.
Okay, all right, thank you. All right. Mr. Yule, anything to comment on? Okay, thank you. Apologize for that, and we'll close the public hearing and move on. I appreciate the accommodation there. We've got a few more cards this evening. Rest one from Mayor Lee Levy. Mr. Levy? Well, we can try to accommodate. Yeah, we don't have necessarily parliamentary rules, but we can let Ms. Hall speak. So sure, appreciate that. I appreciate that. All right, next card I have this evening is from Miss Lisa Ulrey.
I think she was going to speak.
Oh, she wants. Okay, so we want to have Charlotte down. Okay, all right. Well, we'll do Miss Charlotte Whitehall then. How about that? We'll just work everybody down here. Okay, thank you.
Yeah.
Can we get your name and address for the record, please?
My name is Charlotte Whitehall. I'm at 7101 Lakota Ridge Drive, Hamilton, 45011. Okay. And I'm not here as a Middletown resident, obviously, but I'm a Butler County resident who does a ton of trapping, about 400 cats a year, a lot of them in this city. I've done it for 10 years. I've provided free spay-neuter for many Middletown residents, pets too, and I used to run Hamilton County's SPCA feral cat program. I'm here not as a cat lover, there's plenty of them here, but I'm here as a trained scientist who understands data and outcomes, and one who's employed in the field. You saw I put it on Facebook, but 75% of the comments generated from my posting about this ordinance were negative. And that actually reflects a national survey that was conducted showing that 80% of people in a community support feral cats being there if their only alternative was death, whether that's death through euthanasia or being starved to death through an ordinance that bans feeding. In my opinion, this ordinance is not supported by the state of the science as currently practiced, and it's actually going to make your problem worse. I don't know if you're aware, but many apartment complexes, trailer parks, and main big-time landlords here already ban people from feeding, but the residents do it anyway, and there's cats everywhere where these people live. And the reason is people aren't going to stop feeding. They're going to go underground, they're going to hide it, but they don't want to see animals starve. And more importantly, they're not going to come to me for help anymore. When I unload my traps out of my car, everybody sees it, and that's how I get a lot of referrals, actually. So people are going to try to avoid detection by asking for spay-neuter. So their colonies are going to get bigger, and all the cat behaviors that go along with it. There will be some people who will heed the ordinance. They'll be afraid to feed the cats, but that just means the cats they're feeding, they're going to spread out. And they're going to bring all that behavior with them. They're going to dumpster dive, knock over trash cans, hit up bird feeders, street trash, that kind of stuff. Good times. So while I agree with the daytime feeding portion, I think a full ban is inappropriate. I think sometimes people propose feeding bans just hoping the cats are going to just wander off, whether that means Franklin or Monroe, I don't know. But the cats don't go far. They just don't. That 8-acre thing she talked about, that's an anomaly. That's an unfixed male in farm country. Usually the cats will go 1 block or 2 blocks, and that's about it. And the reason is, in a city like Middletown, there's another colony 2 blocks over, and those guys are now going to be fighting for scraps, and I mean cat street fighting. And so they're going to fight off any newcomers, protecting that food source. So I find myself speaking in a city where a man who actually set a cat on fire got probation, but somebody who continually feeds the cats could theoretically go to jail, and it just feels weird to me. So, almost done here, but the ordinance indicated there may be permission from the city for feeders to feed, and I think that's a wonderful thing. And I'm just more curious about what that plans for permission mean. Does it mean if somebody's actually truly taken steps to TNR their colony, or are they in the middle of doing it? That would be wonderful. Last, I'm here, and we're all here, and this ordinance exists because feral cat populations are correlated to average income levels, studies have shown. So as long as you have lots of low-income housing with a lot of turnover, you are not going to be able to legislate this problem away. Obviously, as an advocate, I would say that low-cost spay neuter for pet cats and trap neuter return are the solutions. And I know that takes a lot of time and that can be frustrating, but it took us years to get to this point with this problem. So we can be more effective, I certainly can be, where we can focus on areas where there are the most complaints or there have been animals hurt, rather than I'm taking first come, first serve on my requests. I think collars and microchipping, I don't have a feeling about that. But I would say my recommendations are based on case studies presented by national organizations. And I know those organizations are somewhere else and they don't have constituents in Middletown calling them, but their studies are based on scientific methods. And cities that have implemented these methods have seen nuisance calls decrease as much as 90%. So I think that's a good thing. So I appreciate your time and I hope we can all work together to solve this in a humane manner. Thanks. By the way, she's seen this, but there is some brochures that put out by a national organization. I have some with me if you ever care to see what they feel work and don't work. Thanks.
Thank you.
Oh, I was supposed to ask. I assume you're not going through all the comment cards. Is that correct? Not everybody's going to get to speak?
Oh, we're going to try.
Okay, there's a
keep
gentleman
moving.
who didn't make it in on time
Oh,
and asked me to
okay.
turn on
All right, we can try to accommodate that.
Thanks.
All right, next card I have this evening is from Miss Lisa Oni. Good evening. If we could get your name and address for the record, please.
Sure. It's Lisa Oni, 4631 Seaball Drive, Franklin, Ohio. Property owner, trapper. I'm here tonight because the ordinance as written could be interpreted to mean that all stray and feral cats must be microchipped. Mrs. Fox was emailed asking if this interpretation was correct. Her response was that interpretation issues would be addressed as the ordinance is rolled out if passed. If I've interpreted this incorrectly, I apologize, but wanted to voice my concerns. The microchip section is full of complications. What about all the cats that have already been fixed? An ear tip is generally a sign of a stray or feral cat that lives on the street. What about cats found at local businesses? Who are they to be registered to? If a citizen takes a cat to Animal Friends, hoping they find it a home, but it's returned ear clipped, rabies shot, TNR'd, why does that citizen have to be associated with it just because they're trying to help? Who will register the chip? I cannot afford, nor the people that I work with, an extra $20 to $60 for microchipping each feral and feeders. It costs up to $200 at a local vet to have an animal fixed, combo tested, and there's shots to get them ready for adoption or to go back on the street as me and my constituents do. Alongside of the rescues this year, you have Good Samaritans that I've worked with that have spent over $33,000 above and beyond what your rescues are doing. There again, I can't afford the extra $20 to $60 to microchip each ferals, and the feeders can also. Animal Friends has already stated they cannot afford the chips, so a significant number of cats are going to return not having them. And once again, you trap cats, it's pretty much impossible to trap them again. A cat becomes trap savvy, that's the problem with the last 12. We already have a place for 6 of them to go. It's just impossible getting them trapped. We've been actively working on this. We're trying to help to deal with the city problems, but there again, with the private properties, there's an issue. When you have to microchip a cat, okay, to scan that cat, a feral cat would have to be sedated. That means that cat would have to be held overnight in order for the sedation to wear off. The ordinance is also not clear if all unowned cats have to be fixed by 2020. While we appreciate the grace period, this is impossible to do. On a good day, a standard vet can fix 10 cats without any other appointments or complications of the surgeries they're doing. And at an affordable cost, like I said, of $200 a piece, that's 1,000 surgery days, which is not available from Animal Friends, OAR, UCAN, and the local vets that are helping to curb this population. I feel this is unreasonable and burdensome on the average citizen or Good Samaritan. I would ask for a delay in the vote next month in order to clarify what you're enacting. Thank you.
Thank you. All right, the next card I have this evening is from Mr. Paul Click. Good evening. If we get your name and address for the record, please.
Yep. Paul Click, 5018 Central Avenue.
Good evening.
Evening. I live at the extreme end of Central Avenue, East End. Apparently my property's kind of been a magnet for 25 years I've been there. I've been visited by everything from cats, dogs, deer, skunk, fox, groundhog. No problem, really. I mean, they come and they go. But in contrast to that, I'm also in proximity of a bowling alley, 3 bars, a gas station, Bavarian Woods, Vienna Forest. I can go out in my yard almost any day, pick up trash, hypodermics. The other day, helped hold a guy down that was out there drunk, road rage, till the police got there. I don't think the animals are the problem out there where I live. I don't think stray animals is a good use of a concentration of city resources. That's it.
Okay, well, thanks for sharing your thoughts. Appreciate you coming down this evening. All right, next card I have is from Miss Amanda Schuster. Good evening. If we could get your name and address for the record, please.
Amanda Schuster, 1809 Sherman Avenue.
Okay.
What I have to say is a little long. I would beg the council's indulgence to maybe take up a minute or two of my husband's time. He's the next
Okay.
one there. I'm writing this letter to express my disappointment and disgust over this sloppy piece of legislation. Criminalizing the abandonment of animals sounds good on paper until you consider that the city has allowed vast holes regarding the seizure and handling of these animals. The seizure of these animals will likely result in their almost immediate destruction. The legislature doesn't impose any minimum hold times. It is left to the facility that the city chooses to contract with. There is also a lack of clarity on how an animal is deemed to be a nuisance and when it is appropriate to seize them. This gross negligence could lead to the wholesale destruction of animals that are guilty of nothing more than trying to make the best of a situation not their making, them living just where they can. Causing criminal charges to be brought against people who are trying to ease the suffering of these confused and lost animals will only cause greater distress to these animals. Cats that are in controlled colonies that are monitored and cared for will be hurt by this legislation, which on its surface is aimed at curbing feral and out-of-control colonies but can easily be turned against the maintained colonies. There's a significant lack of resources of the city to responsibly intake and care for animals that it seizes for being declared a nuisance or for lack of easily obtained guardianship information. The proposed legislation is hazy on guidelines for the shelters to abide by before deciding to destroy an animal. There are also no clear guidelines stipulated as to how guardianship of a reported animal will be vetted. This lack of guidelines seems to indicate that the city welcomes the wholesale slaughter of victims of pet abandonment. These animals didn't ask to be left on the street to fend for themselves. These animals are only acting as nature tells them to. Punishing the animals for the action of their previous irresponsible owners by killing them is extreme. Many of these animals could be rehomed if the city instead focused on funding a low-cost no-spay-neuter service that provided rehabilitation for animals that are declared suitable for such actions. It has been proven in many major cities that funding these programs drastically reduces overpopulation and that the adoption of such animals that are suitable to carefully vetted owners also keeps street cat population to a minimum. On the other side of this, punishing the caring people who have stepped up and tried to ease the suffering of these neglected animals is not in the best interest of anyone involved. Removing a trusted food source will cause the animals to look elsewhere for food or even get into fights over such things if it is now seen as a scarce resource. There's a managed colony in my neighborhood and none of the cats involved ever fight over food, not even with other species, since the food is not regarded as something worth fighting over. If, however, these animals are declared unwanted in whatever neighborhoods they're living in, please allocate resources to relocate them. Don't just wantonly kill them because it's easier. I also have issue with the city declaring that I shall feed animals on my own property at times deemed appropriate by the city. However, I can see the wisdom of not allowing food to be unattended, which can attract pest species such as raccoons or skunks. Putting such limitations on colony feedings at locations such as public property or property not owned or maintained by the feeder makes sense, since the person involved cannot monitor which animals are consuming the food. I can understand this need to curtail feeding in public or unmonitored spaces. However, the city fining me for feeding animals on my property is a gross overreach of government authority. The city also choosing to seize and possibly destroy animals that are only fed on my property and are not a threat to anyone is something I will not stand idly by and allow. The wording of this ordinance allows for all these things and is not humane, responsible, or even fully enforceable. The way this legislation reads, colonies that are controlled, cared for, and have limited reach are in just as much danger of being murdered as colonies of completely fair animals that are causing harm to people or other animals. I believe that the animals, people, and city of Middletown would be better served by the creation of a humane society or other such body that would allow for humane population control via spay-neuter clinics and adoption foster procedures, rather than the outright roundup and slaughter this legislature seems to call for. The pushing through of this legislation, rather than focusing on rehabilitation and responsible control, will also inundate our already overworked police force with petty complaints. Our police force is already forcing people who are the victims of nonviolent crimes to file their own police reports online versus getting an officer dispatched to them. My last encounter with this system in February of this year suggested there was over a 2-week backlog before these complaints would actually be filed and assigned to an officer. Rewording this legislation for clearer definitions of when an animal is nuisance would help restrict the number of innocuous complaints the police department would receive, thus allowing them to deal with true animal problems such as violent attacks. Please consider adding language to this ordinance to mandate long hold times for seized animals and delineation of procedures used to identify an animal's owners or caretakers. Please remove language allowing the destruction of animals for some unknown reason. Please only allow for destruction of animals if they are deemed unhealthy and untreatable by a neutral veterinarian. Please remove language that makes it a finable offense to feed animals on your own property. Please allow there to be designated caregivers for colonies that cannot be rehomed due to behavior or inability to adapt to inside living. Please declare that nuisance is more of a violent threat than the unstoppable behavior of an animal, such as defecating. I also ask for language to be included which calls for the creation and maintenance of low-cost, no-cost spay and neuter programs and the establishment of a no-kill shelter in the area with low-cost adoption.
Thank you. Appreciate you coming down this evening. And with that, I'll invite Mr. Tan Schuster. Good evening. If you get your name and address for the record, please.
Ian Schuster, 1809 Sherman Avenue, right there with my wife. I'm not a public speaker. I'm not as good as my wife. She comes all prepared. I just came from work a little early, trying to do something about this. I don't do much. I don't go out and party. I don't have a lot of things like that. I keep to myself. One thing I do, I sit on my porch. There's a feral colony that goes between our house and a house about 3 houses down. They know we're friendly. We feed them. We sit on the porch. They sit on our lap. Never seen any of them fight. Never seen anybody have a problem with them. The kids that visit the neighbors, they come over to our porch and sit on our porch and play with the cats. We haven't had a single feral that has been hostile or destructive or even fought back against a kid. We haven't had a birth in that colony for years. And the thought that these could be rounded up because some guy down the street sees a cat dart in front of his car, says that's a nuisance and calls the cops, that's just heartbreaking. I mean, if I could bring all the cats in and keep them, sure. I can't afford that, and I can't clean up after that. But I got no problem with them doing their business in my yard. That's really all I got to say. I mean,
I appreciate you coming down this evening. Thank you. Thank you. And the last card I have this evening is from Mr. Michael Hobbs. Mr. Hobbs. Good evening. If we get your name and address for the record, please.
Michael Hobbs, 1815 Sherman Avenue. We're not a charitable organization. My wife and I have had 400 plus cats spayed or neutered since we've lived on Sherman Avenue. We've never had an incident with any problems with the ferals. The squirrels, the raccoons and the possums, they tear up garbage. The cats are fed. They don't have any reason to tear up garbage. They're taken so good care of, they don't even chase mice. I just don't want to see it go back to how it was in the 50s. In the 50s, if you had a cat and it had kittens, and one of those kittens scratched a neighbor, the police came to your house. And I experienced this. And the next thing that happened after that was all the kittens were put in a burlap bag and thrown in the river. That's how they dealt with it. And spay and neuter, there's places that charge nothing. We've helped everybody we can to get their pet spayed or neutered. And with help from all the neighbors and the Good Samaritans, I think this has been blown way out of proportion. I mean, when we moved there, there were more cats than I'd ever seen. Now, we've had the same major colony of cats for several years. Nobody ever complains. Nobody's ever been hurt. And I mean, we pay for it out of our pocket unless somebody gives us some food. But if we had to start paying to microchip every cat we take care of, that would be a whole lot of cats less being taken care of. Not just from us, but a whole lot of people. And I don't think that when this was written, anybody took into consideration the hundreds of people that are doing the same thing we are. I mean, I'm totally disabled, my wife's disabled, and we live on a fixed income. And we've been able to keep this going the last 15 years without one person ever being harmed. And I think it's just been totally blown out of proportion. But if you start putting fees and microchipping and all that on the people that are doing it for nothing, they're going to stop doing it because they can't afford it. I mean, it's all you, when you're feeding 20 to 30 cats, it's all you can do to feed them. And take them to the vet, make sure they get their shots, and find home for them when you can. And I just think this should be rethought over, and people should know that just how many people there are that care about. I mean, there's more cat owners in this country than there are dog owners, and that's a fact. And I remember when cats weren't allowed to go out of a yard, and it never worked. They'd end up killing them when they did. And I don't want to see it go back to that. And I just think there's a lot of stuff in there that would add extra expense that you're going to lose all the people that are doing it on their own, out of their own pocket, out of love of animals. Over some people complaining that a car ran, or that one ran out in the street, or went to the bathroom in their yard. I mean, I really think it should be rethought a whole lot.
Yeah. Thank you for coming down this evening. Appreciate that. All right. That concludes the comment cards I've received this evening. We can move to our consent agenda. Ms. Gank?
For your consideration this evening, we're going to confirm the personnel appointments of Ida Hawkins, paralegal in the Department of Administrative Services, Christy Isaac, the part-time building cleaner for the Division of Police, Trace Jordan, a corrections officer for the Department of Public Safety, Division of Police. To authorize the city manager to enter into a contract with Performance Site Management to proceed with the Gideon Road storm sewer improvements. To authorize the city manager to enter into a contract with Granite Inliner to proceed with the 2019 sewer lining project. To approve the purchase of network equipment off the ODAS contract for the Department of Information Systems in the total amount of $67,818.64 from AdviseX Technologies. To receive and file an application for expansion of the DORA boundary. To confirm the following in accordance with ordinance numbers O 2018-81 and O 2018-82, effective January 1st, 2019, as outlined in the staff report. Title change only for Ashley Combs, City Planner to Planning Director. Shelby Quinlivan, Communications Coordinator to Communications Manager. Audrey Morris, Secretary 3 to Secretary. Jessica White, Secretary 3 to Secretary. Mary Miller, Terry Gibson, Michelle McDowell, and Melissa Phelps, all from Secretary 3 to Secretary. And then the following appointments: Allison Manning from Natural Resources Coordinator, Range 176, Step A. Julie Owsley, Administrative Assistant to Paralegal, from Range 183, Step F. And Susan Cohen, General Counsel to Administrative Services Director, Range 168, Step B.
Okay, do we have a motion for the approval of the issues and actions as listed on the consent agenda?
So moved.
Second. Okay, Ms. Skank, would you call the roll, please?
Mr. Mulligan?
Yes.
Mayor Mulligan?
Yes.
Mr. Bohannon?
Yes.
Mr. Moon?
Yes.
All right, we have two motion items this evening. The first is to authorize the city manager to enter into a contract for services with community development partners for the administration of the CDBG home funds and reporting services. Do you have a motion to adopt?
Second.
Okay, Mr. Atkins?
Yes, Your Honor. We have previously in-house used our people to administer the CDBG and home funds through HUD. We are simplifying some of those programs and are also streamlining some of our services. With that in mind, we'd like to contract with community development professionals. They would be paid entirely under the administrative part of the grant. There would be no general fund dollars. I've done work with them for several years when I was on community revitalization. They currently handle all of these counties' homeless grants, and they've done that for several years. So I'm very familiar with their work.
Very good. Any questions, Mr. Atkins?
Just a brief one. Mr. Atkins, I assume the overhead cost is similar or less than what it would be if we kept it in-house?
It would be less.
Anything else? All right, Ms. Skank, would you call the roll, please?
Mayor Mulligan?
Yes.
Mr. Bohannon?
Yes.
Mr. Moon?
Yes.
Mr. Mulligan?
Yes.
Then to authorize a contract with American Fidelity Stealth for stop-loss coverage in 2019.
Okay, do we have a motion to adopt?
So moved.
Second. Mr. Atkins?
Yes, Your Honor. Our health insurance broker has coordinated the RFP process for our 2019 stop-loss coverage. We did receive quotes from 2 vendors this year. The Healthcare Committee had gone through both of those in detail, and for the pros and cons listed in your staff report, are recommending going with the slightly higher price with American Fidelity Stealth. We're recommending approval.
Okay, any questions for Mr. Atkins? All right, Ms. Skank, would you call the roll, please?
Mr. Bohannon?
Yes.
Mr. Moon?
Yes.
Mr. Mulligan?
Yes.
Mayor Mulligan?
Yes. Thank you. That brings us to council comments. Mr. Mulligan?
Thank you, Your Honor. First, thanks to the representatives and the citizens that came out tonight. This has really been an example of democracy in action, and I know council will take into account the testimony that was provided today, and as we come to our decisions and deal with the legislation before us. And then next, I express my thanks to Clerk of Council, Mrs. Skank, for leading the planning for the employee Christmas party last Friday. It was a great way to cap off, or at least kick off, the holiday season. And I wish all the members of the staff of the city of Middletown the very best for a restful Christmas and holiday break. And as Mr. Adkins pointed out, get some rest, because there's a lot teed up for 2019. Also had the opportunity for a behind-the-scenes tour. There was a city delegation that toured AK Steel in the recent couple weeks, and we gained a new appreciation for what goes on inside AK, and really was fascinating. We didn't cover all 4,700 acres, but we came pretty close, and we wish them the best in their future, and appreciate their investment in Middletown. And finally, a goodbye and best wishes to our Downtown YMCA Executive Director, Angela Howard. She has taken on a position in Florida, and she has been with the Great Miami Valley YMCA for the past 14 years, and made a great impact during her time in downtown Middletown. So I wish her the best. Thank you, Your Honor.
Thank you. Mr. Bohannon?
Well, thank you, Mayor. Next year, I think I'm going to sit on that side so I can say some things, because he said everything I was going to say for the most part. Again, thank everyone for coming out. Also, wish everyone a happy New Year, happy Merry Christmas. Be safe, and we'll see you in 2019. Thank you.
Okay, thank you. Vice Mayor Moon?
Yes, I'll be brief. I'll just thank everyone as well for coming out tonight. Happy holidays and Happy New Year, and we look forward to a great 2019. That's all I have.
Thank you. I'll just reiterate those comments. Certainly appreciate the feedback and input from everyone. I'd encourage a number of people have emailed us over the issues, and that's a great way to get the communication and understand clearly what the issues are. Certainly understand the passion around it and the care and support, and I think we're ultimately trying to work towards the same direction, the betterment of Middletown and the overall improvement. So I certainly appreciate everyone's efforts in those regards. And like my colleagues, I'd like to extend a happy holiday greeting to everyone and best wishes for a happy new year, and look forward to seeing everyone in 2019. And with that, we can move to our legislation. Ms. Fox?
Good evening, Mr. Mayor. Tonight there are 7 items of legislation, 3 of which are emergencies and therefore will require a waiver of the charter provisions, ordering 2 separate readings. That would be in regards to resolution number R 2018-33, R 2018-34, and R 2018-35.
I move to waive the charter provision requiring readings on 2 separate days and to declare the previously read resolutions an emergency measure and read one time only.
Second.
Okay, Ms. Gack, would you call the roll, please?
Mr. Bohannon?
Yes.
Mr. Moon?
Yes.
Mr. Mulligan?
Yes.
Mayor Mulligan?
Yes.
Resolution number R 2018-33, a resolution to make adjustments to appropriations for current expenses and other expenditures of the City of Middletown, Counties of Butler and Warren, State of Ohio, for the period ending December 31st, 2018, and declaring an emergency.
Okay, do a motion to adopt?
So moved.
Second.
Okay, Mr. Atkins?
Yes, Your Honor, this is one of the year-end cleanup items from Finance. This is our supplemental appropriation and de-appropriation requests. Prior to year-end, they have a 0 net effect on the general fund, but they do allow us to move money around within line items to make sure we're in compliance with the revised code as we close the books for the year. The general fund's supplemental appropriations and de-appropriations total $425,000 for a net 0 effect.
Any questions for Mr. Atkins? All right, Ms. Gack, would you call the roll, please?
Mr. Moon?
Yes.
Mr. Mulligan?
Yes.
Mayor Mulligan?
Yes.
Mr. Bohannon?
Yes.
Resolution number R 2018-34, a resolution authorizing a transfer from the general fund to the airport capital fund and declaring an emergency.
A motion to adopt?
So moved.
Second.
Mr. Atkins?
Yes, Your Honor, we are requesting a supplemental appropriation. This is again for year-end from the general fund in the amount of $18,681 to the airport capital fund. We are working on reimbursement for some of the work done on the airport infrastructure this year. It is currently carrying a negative balance that would cover that $18,680.65. This would put us back to 0, which puts us in compliance with the Ohio Revised Code and the audit. This would be reimbursed by grants in 2019.
Okay. Any questions or comments? Ms. Gack, would you call the roll, please?
Mr. Mulligan?
Yes.
Mayor Mulligan?
Yes.
Mr. Bohannon?
Yes.
Mr. Moon?
Yes.
Resolution number R 2018-35, a resolution authorizing transfers of various funds and declaring an emergency.
Okay, do a motion to adopt?
So moved.
Second.
Okay, Mr. Atkins?
Yes, Your Honor. Each year you pass this resolution. This is a listing of all the transfers that have been made during the year. You've already done legislation in other areas during the year to approve each of these individually, but as part of closing the books for the year, the Ohio Revised Code wants us to put this resolution together. This is a summary of everything that you've done so far. No money's changing hands. This is just simply a listing of your prior approvals.
Questions or comments? Ms. Gack, would you call the roll, please?
Mayor Mulligan?
Yes.
Mr. Bohannon?
Yes.
Mr. Moon?
Yes.
Mr. Mulligan?
Yes.
Ordinance number O 2018-86, an ordinance amending Chapter 618, which addresses animals of the codified ordinances. This is a first reading.
Yeah, Mr. Atkins?
Yes, Your Honor. With the addition of our new animal control officer and some issues with animals running at large throughout the city, we have recommended a number of changes to our ordinance. There were also some mandatory changes that were needed to be completed to comply with the Ohio Revised Code in regards to the section that addresses dangerous dogs. Obviously, this is one of those issues that gets people wound up, and I appreciate that. One of the things as I was sitting there taking notes is, what you heard today was a passion and good people who are trying to do good work. and I don't take anything away from what they've done. What you also heard, though, was 400 plus cats in Sherman. When we had 50 in the condos at Smith Park. I was in community revitalization when we took out 100 mobile homes over on Germantown Road. We had well over 100 cats living in the abandoned homes. You've heard, I've never seen so many cats. You've heard about feral colonies of 20 to 30 cats. You've heard $33,000 spent above and beyond what rescues are paying. This is not what a normal city would be dealing with in this situation. This is the result of 10 years of having no animal control whatsoever since the recession. We are different than Mason or some other places in that we're able to maintain their animal control throughout the last decade. And again, we've seen this in other areas, not only with animals, but in so many areas where the city had to pull back in areas because we simply didn't have the manpower and the resources to do what we should have done all along. Good intentioned people come in and try to fill the void, and their hearts are good, their intentions are good, and a lot of times their actions are good. But this is a large problem. We do have complaints on an ongoing basis, and while I appreciate everyone that has a cat and that's taking care of these cats, and I appreciate their concerns, we also have to listen to the people who have said, I got people, I got my yard's full of cat poop. I got stuff going on, with cats fighting and this and that. I have to listen to them as well. This is a policy issue. This is a balancing act. We've had several meetings with an awful lot of people. This has been several months of work to put this together. I'm not sure there's a right answer. This is the best answer that we could put together for you. I have problems with the spay and neuter, not because of the humanitarian part, but you're talking about thousands of feral cats, and if you spay and neuter them, which I get everything they're saying, you're talking about another 7 to 10 years of all those cats running around the city. If we're okay with that as a community, that's fine. We've had problems, and we've talked about with these groups about the feeding, especially at Smith Park, the condos that were causing there, we were bringing in skunks and raccoons. And so this is not something we threw together on the fly. This has been going for probably 8 to 12 months of work. We've looked at other communities. We've seen the spay and neuter stuff. We've seen the take them out and take them to the shelter. And this is our best attempt to deal with the problem given the scope of the problem. It's not an ideal solution, but it is not an ideal problem either. We are, again, you heard 400 cats just in Sherman. That's outstanding. I mean, I'm not sure we have that many squirrels. Please let me finish. I'm happy to listen to you. This is not an ideal situation. So, we're going to have to continue. I hope that they continue to talk to you. I will continue to talk to you. This is our best attempt to start controlling the situation. Again, it's not an ideal situation, and we knew as we brought this forward that a lot of the people were not going to be happy with the outcome that we came to. So we will be available for questions as council has them, and we will do our best to answer your questions, make any adjustments that need to be made. And if this is not something that council wants to do, we will certainly, take another look at it and go another direction. But I want to make it clear that we've been working on this for months. So this is not something that, if you got another direction, you're going to have to give us pretty specific because we've been looking at this for a long time. So it's not an ideal situation, and there's not an ideal solution to taking care of it, especially on the short term. So.
Okay. Any other questions, Mr. Atkins? Yeah. Ms. Fox?
Ordinance number O-2018-87, an ordinance establishing a procedure for and authorizing a contract with Pathmaster Incorporated for the purchase of Centrax traffic management software. This is a first reading.
Mr. Atkins?
Yes, Your Honor. The city utilizes the Centrax traffic management software for our traffic control signal system. We buy software licenses in blocks of 50. We have been making upgrades for the last couple of years since 2016. We are at the end of that 50 limit, and we must purchase them in 25 licensed blocks. We are ready to do that so we can continue to move on with our upgrades of the signals. There is money in the 2019 capital budget and the electronics maintenance budget for this purchase. They are our vendor for this purpose.
Okay, any questions, Mr. Atkins? Okay, thank you.
Ordinance number O-2018-88, an ordinance amending section 1040.03 of the codified ordinances levying and assessing sewer rates. This is a first reading.
Mr. Atkins?
Yes, Your Honor. The city, as you're aware, is working on our long-term control plan and our consent decree with the EPA. As part of the planning for that, sewer rates are being adjusted up by 10%. Even with that, we are still ranked 53rd out of the 63 communities for sewer rates based on 2017 Oakwood water and sewer rate for Southwest Ohio, which means we are in the bottom quarter, even though we've been going up for a couple years. So this again has to do with our implementation of the long-term control plan.
Very good. Any questions for Mr. Atkins? All right, thank you.
Ordinance number O-2018-89, an ordinance changing the zoning classification for two parcels. One parcel located at the 3400 block of Union Road and one parcel located at 6147 West State Route 122 to a BCO Business Center office. This is a first reading.
All right, this was subject to our public hearing this evening. Anything to add, Mr. Atkins?
No, thank you, Your Honor.
Okay. Any other questions or comments from council? All right, thank you. With that, we will not have an executive session this evening, so our next meeting will be on January 8th, 2019. I wish it were July, but January 8th, 2019, in these chambers at 5:30. Thank you all. Have a good evening and Merry Christmas.
Thank you, Your Honor.
Okay. 7:09. Yeah, well, appreciate the work.